Hi, it's Dr. Centeno, and today we've got a really critical piece of information to relay out there. This is one of those videos that you're going to want to share with pretty much everyone you know, especially friends and family who have had a birth tissue, quote, stem cell injection. Air quotes are intentional there, because Medicare just announced, and this morning I thought it was just Florida, but I just found out it's the entire nation, that they are clawing back all of the payments they made for that procedure going back to December 6th of 2019. So what that means is that if you went to a clinic or a loved one or friend went to a clinic who said that they were going to give you a stem cell procedure that was based on amniotic tissue, umbilical cord, or placental tissue, that basically, that clinic then billed Medicare and got paid. The patient probably thinks everything is great because they didn't have to pay that bill, but now they do, because Medicare is taking that payment back, meaning Medicare will now ask the clinic for all of their money back. And if you sign an advance beneficiary notice, then you owe the clinic that money back. So let's break this down a little bit, because it also is going to include and is increasingly including private payers as well. So if you know anyone who told you, hey, I got a stem cell procedure covered by insurance that was amniotic, umbilical cord, or related to the placenta, and somehow an insurance company or Medicare paid it, that person probably owes a lot of money. So you're going to really want to make sure you share this video out with everyone possible, because we're talking about anywhere from $4,000 to $20,000 that person will owe back to the clinic. Now, how do you figure out how much you owe? Well, take the number of areas you got injected and multiply by 4,000, and that's a pretty good guess. So let's say you got your right shoulder and your back and both knees injected. That's 4 areas. You owe $16,000 back to that provider, because that provider owes $16,000 back to Medicare. Now, there's one thing here where you may not owe that money, and this is a critical thing. If you did not sign an advance beneficiary notice called an ABN, then you don't owe that money back. But most of these clinics probably slipped an advance beneficiary notice into the new patient paperwork if they knew you were a Medicare patient. So just realize that at the end of the day, most people who had these procedures are probably going to owe this money back to the clinic. Now, what if you say, I don't have $16,000 to pay back to the clinic? They told me it was covered. So why is this a big deal? I should have to pay this money back at all. Well, there is one possible solution there, and I would encourage you to do this. I would contact the state attorney general's office where you are and register a complaint against the clinic, because not only was this fraud from the standpoint that the birth tissues never had any stem cells at all, but it was also possibly elder abuse in some states. So I think that's your only angle, if you will, to try and not have to pay back tens of thousands of dollars to the provider that did this scammy procedure. So again, for those just joining us, we're talking today first about this big Medicare announcement, but then also I'll answer any questions as well. So just to reiterate and make sure everyone's clear, right now, and all this last week, Medicare has been announcing that they are clawing back payments they made in error for birth tissue stem cell injections. So that's amniotic, placental, and umbilical cord injections that a patient may have received for pain conditions. So neck pain, back pain, shoulder pain, knee pain. So if Medicare or a private insurance company paid for that stuff, it's very clear now that the clinic's going to have to pay all that money back. And how much money we're talking about? A lot. as I figure it, since it's $4,000 a body part, we're talking about each clinic having to pay back several hundred thousand up to $10 million in erroneous payments that they got. Now, the clinics knew this wasn't covered, but the sales reps convinced them to bill this. They were using special billing companies to get it paid. But now that money's got to come back. And the reason why I'm talking to you about this is if you're a patient, you had one of these done, and it got paid, you're going to owe a ton of money back to that clinic because your bank account is the only way that clinic is staying out of bankruptcy. So again, want to be very, very clear here, and please share this with as many people as you know who may have gotten these injections, because this is a big deal. Now, if all of those people start complaining to state attorney generals, then you may not owe this money back. But that's going to start now in mass to prevent literally hundreds of millions of dollars having to be paid back by unsuspecting patients who didn't know that this wasn't really covered. But they're going to owe that money back anyway. And again, take the number of body parts you got injected, multiply by 4,000, and that's the amount of money you will owe back to that clinic. So again, bilateral knees, bilateral shoulders, 16 grand. Add a low back in there, 20 grand. Bilateral knees, 8 grand. And the only way you're not going to be able to pay that back is if you didn't sign an advanced beneficiary notice, or what's called an ABN. And if it got billed to your private healthcare carrier, there's no way around that. You're going to have to pay it back. But if you don't want to pay it back, then now's the time to contact your state attorney general, especially if you're elderly, because there are elder abuse laws in most states, because this was a scam from the beginning. There were no stem cells in any of those products. That's clear now based on the peer-reviewed research. And in addition to that, obviously it was a scam to bill it to these carriers. So again, I'll close out my sort of monologue here, and we'll start taking questions. Questions about this or questions about anything, as I always do. But this is an important one. Please share this with everyone you know, because you may have a friend or family member who owes back a tremendous amount of money that they don't have because they got one of these injections. So again, Medicare, the entire nation of Medicare, meaning every Medicare administrative contractor, has just announced that they are clawing back all of this money. United Healthcare has done the same. I would expect Blue Cross Blue Shield, Cigna, Aetna, et cetera, to do the same. So this is going to be probably the largest Medicare fraud investigation in history. I think the prior record for clinics is about $100 million. This is clearly going to be about $300 to $500 million in payback. And there will be some people going to jail because of this billing scam that's been going on for some time. So let me take some questions now. I don't want to sit here and do a monologue all day, but that was an important one to get out, because you may know someone who is caught up in this and owes a tremendous amount of money back. So let me start taking some questions. Submitted in advance by Harry Winston. Wouldn't it be the clinic who would be responsible? Can they legally hold the patient responsible? Yeah, Harry, this is a very important thing to understand here, because if you're a Medicare patient first, what's called an advanced beneficiary notice, or what we call an ABN, then you owe the money because Medicare just deemed it a non-covered service. And that's what that form says. If it's a non-covered service, then it's your responsibility as the patient. Now, as a Medicare patient, if you didn't sign that form, you don't owe the money. So if you did this, the first thing you want to do is to call the clinic and say, do you have an ABN, advanced beneficiary notice, on file for me? And if they say, no, we don't have one on file for you, then you are in the clear. You don't need to do anything. You don't owe anybody anything. If they try to bill you, you just complain to Medicare. If you did sign that form, which is pretty common these days to have patients sign those forms, then you do owe that money back. And if it's a private healthcare insurer, you definitely owe that money back because it's a non-covered service that you received and your insurer denied. And that's in the standard clinic sign-up forms that are out there. So no, it's usually the patient that will have to pay here. And it's a lot of money. Again, take the number of body areas injected, multiply by 4,000, and that's what you're going to owe. Adrienne, I've confused myself recently. Does the PAOM impact the dura at all? Is it only the myodural bridge that does? Yeah, so let's talk a little bit about that, shifting gears here from Medicare fraud. The dura is the covering of the spinal cord and nerve roots, or the beginning of the nerve roots. And in the back here, it is adherent in the upper cervical spine to what's called the posterior atlanto-occipital membrane. And so they're kind of one structure. Now you can separate them out in a cadaver dissection, and that's why we call them two different things. But for all intents and purposes, they're kind of one structure. And then the myodural bridge is the tendon that goes from the rectus capitis, posterior minor, and other areas into that PAOM/dura. So that's how it is all set up back there. Submit advance by Sherry Copland. Why would Medicare cover these treatments and not the PICL procedure? Yeah, Sherry. I mean, they don't cover these treatments. I think that's really the moral of this story, if you will. Meaning they didn't really cover these treatments. That was a scam. Clinics were billing Medicare. And what's interesting about Medicare is you can bill a lot of things to Medicare, but if you bill it in error unknowingly, then you just owe the money back. If you bill it in error knowingly and you get paid, it's 10 years in federal prison per bill. So this is serious stuff for these clinics. So Medicare never did cover any of this. They paid it in error, which Medicare will do. But for the clinics, that's a real problem, because if they billed it unknowingly, they owe the money back. If they billed it knowingly and got paid, it's federal prison time for each doctor that did that, and a long time. Sabrina, I had an abnormal karyotype test result after culturing Caymans 2 years ago, right after COVID shut all that down. The test was repeated. The second time result was normal. Would it be able to explain to me why this abnormal karyotype result happened and is safe to re-inject? You know, Sabrina, I need to know a little bit more about, are we talking about two different samples, the same sample, etc.? If it was repeated on the same sample, then it could have just been the handoff that caused the abnormal karyotype. So I would go with the normal one, because that's not uncommon, but I need to know a little more. And just so patients fully understand what it is we're talking about here, when the cells are grown out to bigger numbers, we test the karyotype, which is the genetic structure of the cells. And that test is done by the University of Colorado here. A sample is sent from Grand Cayman to there. And obviously, there are going to be times where the handoff is not perfect. And that not perfect handoff is usually what causes the abnormal result. So in that case, if there's a normal and an abnormal, I'd go with the normal one as being much more likely to be accurate. But that's assuming we're talking about the same sample and not two different ones. Jackie, how do you feel about red light therapy? Proven to be effective at helping muscle, skin, and other tissue heal. I don't think we have much randomized controlled trial research on red light therapy, so I wouldn't say it's proven to be effective in anything right now. But it can certainly be used with a PICL procedure. Just realize the ligaments we're talking about wouldn't be visible to light, meaning that light is light, right? If you shine a flashlight at your hand, it makes a shadow on the wall. So anything behind your hand is not going to get exposed to that light. In the same way, these internal ligaments we're injecting with PICL are covered by bone, so they're not going to get much light to them. Now, if you're talking about the more superficial ligaments, then if it works, it should work there, but it's not going to work at that depth in areas that are covered by bone. Jackie, if a patient had thoracic blood patch elsewhere, is it safe to do C0 through C3 PRP? I probably need to know a little more. There shouldn't be any relationship, though, between the thoracic blood patch and C0 through C3 PRP. So no real relationship there between those two. And I'm not seeing any other questions. Any other questions I can answer today, guys? Happy to answer anything, not just about this whole Medicare fraud thing, but anything you got. Jay, can you explain the difference between higher dissection and migraine surgery? Yeah, I think what you're talking about there, Jay, would be occipital. Well, correct me if I'm wrong, but I think what you're talking about there in migraine surgery category would be an occipital nerve dissection surgically. So let's start with that. An occipital nerve dissection surgically is when a surgeon makes an incision, goes in, identifies the occipital nerve, tries to free it up and take out the stuff around it. Sometimes fat will be packed in there to give it some cushioning. Now that's a pretty invasive surgery, meaning we're working right around the vessels that go to the brain, and we're working right around, obviously, critical nerves. So you wouldn't want to do that procedure unless everything non-surgical had failed, because you can damage the nerve by doing that kind of dissection much more than it can ever be damaged with something like a needle hydrodissection. So again, you would never want to do that procedure unless you had failed the injection procedure. So now let's go to the injection procedure. The injection procedure involves identifying the nerve and injecting a platelet growth factor mix around the nerve. Now that's both to try to break up any scar tissue around the nerve, as well as to provide growth factors to help the nerve heal. So very, very different deal there between those two things. So just realize that occipital nerve surgical dissection is going to be dramatically more invasive than any type of injection like that. Chris, Misfit, medical question. I have CRPS and the normal procedures get stem cells for me. It's too invasive for me. Allogeneic stem cells last less in your body. It's less effective. If you're to choose allogenic stem cells from fat, would it be better taking them from my sister? Yeah, Chris, there's no legal allogeneic stem cell procedure available to you here in the United States. So nothing exists there. So it's critical that we first understand that. And that does fit with the conversation we're having here, meaning that all of the amniotic, placental, or umbilical cord products on the market that are being sold don't have any living and functional stem cells. Our lab has confirmed that. Lisa Fortier's lab at Cornell has confirmed that. The UC Davis lab has confirmed that. The University or the Colorado State University TMI has confirmed that as well. So that's the first thing. Second thing is it would be illegal to take fat from your sister, isolate stem cells, and put them into you. So that's not going to happen here in the United States. So it's kind of a moot point. Kelly, can a CSF leak cause gait issues and severe imbalance? Can a CSF leak cause gait issues? Not usually. The average or the usual symptoms for CSF leak is a severe ice cream type headache the moment you get up that is dramatically better right after laying down. So that's the most common issue there. Now, if you had a bad CSF leak that was causing the brainstem to herniate through the foramen magnum, so something like a Chiari-1 or beyond a Chiari-1, but not a Chiari-0, then you could get some cerebellar symptoms, which would be gait and imbalance issues. But that would be seen pretty easily on a routine cervical MRI. So if they've told you you have a Chiari-1 or beyond and you have a CSF leak, then yes, I think there's a good connection there. But if you don't have a Chiari-1 or beyond, probably something else is causing that. Greg, how long does it take to get an appointment for a PICL procedure? It's a good question, Greg. I don't handle that. I know it's not tomorrow. I know it's not next week. My guess is somewhere between several weeks and several months. So that'd be a question more for staff at our clinic. Sabrina, Mirna explained of culturing. They always have 2 small batches put aside for testing. The rest is supposed to be reviews. First batch is abnormal, second batch was normal. Is that for single? Yeah. So I think what you're experiencing there is a handoff problem. So I would say not an issue. I would go with the normal result, since I'm the one that designed that testing process, meaning that was my procedure that I designed, including the culturing. Then that would be considered a normal result, not an abnormal result. Does fraud hurt stem cells' reputation getting approved by insurance? Yeah, absolutely. I mean, that's the reason why I have been after these frauds for a long time now, ever since they first started approaching me back in 2014, claiming that they had amniotic stem cells. That's why we tested at our expense a dozen products that were umbilical, amniotic, placental in our own lab. That's why the CSU lab tested them. That's why the Cornell lab tested them. That's why the UC Davis lab tested them. We all found no living and functional stem cells. And then obviously this Medicare thing will hurt this field for a long time, right? Because if you read these denials are talking about, well, if you're using these products for regenerative medicine, then that's denied. And that's going to stick in someone's mind at Medicare for a long time. So yes, it hurts everyone who wants to try to get insurance coverage for these procedures. So these get rich quick guys really hurt everyone. I guess the only consolation prize we have right now is their best move right now, since there's probably going to be arrests made here or charges filed, that these guys are probably going to be getting a burner phone and going out of the country or paying the piper. But I do believe we will see the Justice Department, because of the size of this fraud, announce criminal indictments. What is your opinion as to why neurologists, physiatrists, and spine doctors just do not recognize or treat CCI, IBDS, horrible occipital headache, gait issues, falls dysautonomia, MCAS? Every doctor tells me CCI isn't real unless I have broken my neck. Yeah, Kelly, listen, there's a small cadre of physicians in the US that treat this stuff, and it's a hyper specialization area. So we've got 5 or 6 neurosurgeons around the country that understand it and treat it. And we've got our clinic that understands it and treats it. And then you've got lots and lots of chiropractic clinics who have been using digital motion x-ray for years, who understand it as well. But if you're a traditional medical doctor, you've probably never even heard of it, let alone, and certainly didn't learn anything about it. So if I were to ask the average family doctor, or even an orthopedic surgeon, can you show me where the alar ligament is? I'd get a blank stare. So much of that is just not understanding this part of the body, because it's not something that's normally taught. The other part, I think beyond that, is just related to the fact that the types of problems up here that have traditionally been surgical have involved major trauma and fractures. So if you ask 1,000 neurosurgeons, that's what they're looking for 999 times. The one guy would be the guy who understands and treats CCI, and he's got no problem making that diagnosis. He understands that you don't need a fracture up there. But that's what you're experiencing. That's just part of any hyper-specialization, right? Same thing with dysautonomia. You're probably not going to find most doctors who understand anything about what that is. Kelly, we're ruling out CSF leak, but even still, doctors don't even think that it's due to no brain sag on imaging. Not sure what that last part means, but Kelly, just be careful in ruling out a CSF leak. The imaging studies have a very high false negative rate, meaning that you can get imaging studies in many of these patients, and about 7 out of 10 times you will find nothing, but they clearly have a CSF leak. So just realize that that's a problem with imaging, or using imaging to rule that out. In addition to that, the only way to really rule out a CSF leak is to blood patch the entire spine. And that's not something most people are going to do. So for instance, if we wanted to do the lower thoracic spine, we're talking about 6 to 8 different injections to blood patch the entire lower thoracic spine. another 6 to 8 do the upper thoracic, another 6 to 8 to do the cervical, another 6 to 8 to do the lumbar. All of that would have to be patched, and the person had no results for us to rule out a CSF leak. And then obviously the skull-based CSF leaks are their own animal. Jay, how is it determined if you have a leak? What kind of imaging or process do you need? Just explain that one, Jay. But yeah, it's not easy. But again, it's that what we call pathognomonic, which means what are the symptoms that separate this thing out from other things or other diagnoses? It's that severe ice cream-like headache when you're upright that happens almost immediately, and then it goes away almost immediately when you lay down. So that's when you start thinking about whether or not that needs to be done. Adriana, I've had 3 PAO injections. My 4th is scheduled with my next PICL. Is there any concern? I've had too many injections. It can cause dural tension problems. Similar how you wrote that RCP minor tension can cause it. Wouldn't be concerned about that at this point, Adriana. No. Can stem cells help osteoporosis in the neck? No evidence right now, Ladonna, that stem cells can help osteoporosis in the neck. Damien, what is your perspective on PRP booster every year to maintain cartilage and or tendon integrity? Do you consider it worth a long-term financial cost or overkill? You know, Damien, that's a good question. My overall personal opinion is that if you're doing extremely well, then there's probably no reason to do that. Now, if you're someone who is doing better, but has some low level kind of aching with certain activities in the joint, then that would argue more for a PRP booster. And then you've also got to think about if you're doing it entirely prophylactically, we don't have the data yet to support it, although we've got some good suggestive data that it may help protect cartilage. And then you just have to look at risk benefit, right? If you inject 5,000 knees and you do a really great job of keeping everything sterile with PRP, you might get 1 or 2 infections in there. So that's about the risk you're taking. So it's like anything in medicine, it's risk benefit, risk benefit. Kelly, yeah, I get to suffer a big win for Tennessee. Yeah, Kelly, I don't know what they're doing, but just to let you know, it takes time to do a proper blood patch. And in my experience, most clinics won't do it. Now, the exception to that, and this could be your situation, is if you know where the leak is. So I'll give you an example. Let's say someone had a pregnancy epidural, and we know based on the notes that they went in at L23, interlaminar through the lamina from the back. Well, that one's easy, right? I can do an L23 interlaminar epidural blood patch, and just that one patch, I'll be very confident that it'll either work or not work. But if I don't know where the leak is, and it could be any place from the lumbar spine to the thoracic to the cervical, then I got to patch everything. And there you have to play the odds. And the most likely place for a dural leak based on the odds is the lumbosacral spine, then the thoracic spine, then the cervical spine. Cervical spine being least likely. And the reason is it's a water column, right? And any water column, there's more pressure on the bottom of the water column, which is the lumbosacral spine. So that's something you really want to think about. Which type of leak do you have? Do they know where it is, or do they have no idea where it is? If they have no idea where it is, that's when it gets hard. Kim, what about PRP or stems for scoliosis? Yeah, Kim, we've been doing a scolioplasty procedure now, or at least I have, for about the last 5 years. And I started that procedure because my assistant at the time had very severe scoliosis. And we would do, you know, the average epidural here, facet injection there with PRP, and it would help. But she started to get to the point where she needed more. So we started doing what I call scolioplasty, which is tightening down the intertransverse ligaments on the side of the convexity, and then dealing with the rotation by injecting the posterior thoracodorsal fascia on that same side. And it made a tremendous difference for her. She then shifted into a different gear. And the concept behind scolioplasty injections is that they reduce the penchant for the scoliosis to get worse. So if the spine is straight, no worries. But once it starts to get a bend, it's going to want to bend more and more and more and collapse. So if you can provide some buttress to that collapse, I think there's a lot of value in that. And that's what we've been doing now, or I've been doing now for the last 5 years with scolioplasty. So scolioplasty has been very effective for many of our patients. Does water fasting stimulate more stem cells versus intermittent fasting, and why? Yeah, I think intermittent fasting, or something more similar to what the Prolon diet is, which is going to be fasting mimicking, definitely has an effect on stem cells based on the literature. So I don't know if anyone's ever looked at intermittent fasting versus eating nothing and just drinking water. But we do know that a fasting mimicking diet, which is about 500 to 700 calories, does seem to help. And if you want, obviously you can do that yourself. It's not rocket scientist, just keep your calories there. But if you want to make it easy, there's a company that makes a little package called Prolon. And I think the website is something like prolonmd.com. And that company really makes it very easy. You get a box a day, you eat what's in the box, and that's what you get. So it couldn't be easier. Kelly, yes, I had 4 sticks for epidural with the first kid, 2 on the second. Don't know if CCIAI or CS leak or both, because I have EDS and a doctor in Tennessee has helped. In my own opinion, I've treated horribly and frequently leave appointment sobbing. Yeah, Kelly, it sounds like you just need to see someone who specializes in this stuff. We've treated a lot of dural leaks. There are others around the country who have treated dural leaks. Obviously, or at least my practice is very focused on CCI. And it's just a matter of getting with a doctor who understands what's happening. I think I did 4 evals this morning over telemedicine. And I think 3 of those 4 patients were in the same position. They were told they were crazy. But if you looked at their imaging, there was stuff on their imaging. It just was missed. And no one ever looked at the imaging. They just read the imaging reports. So they got off thanking me because they finally met someone who said, yeah, it's here, here, and here. And that just didn't say you're crazy. So listen, hang in there. I know it's very, very difficult to have these problems and to go to doctors who it's doing this. It's going over their head. They don't understand what to look for. They don't understand what the symptoms are. They don't understand how to work it up. They don't understand how to treat it. And so, listen, doctors being doctors, when they don't understand something, they tend to get defensive, angry at the patient, or both. And so just realize that that's pretty par for the course in the medical care system, regrettably, but hang in there. Shanza, how do you evaluate tendon and muscle damage besides any ligament laxity shown in the DMX? So Shanza, I think you're talking about cervical spine, and tendon or muscle would have to be on physical exam, or obviously then something big enough to see on MRI. Now, what we can see on MRI in cervical spine CCI patients is muscle atrophy, usually at C2-3, and in the high upper cervical spine. So that can be seen on MRI, but the rest of it's going to be physical exam in determining which muscles and tendons to treat. Any other questions, guys? Okay, so I'll start wrapping this up. If any other questions come in, I will go ahead and jump on those. So what we started talking about is a very serious thing that just happened. Medicare has clawed back all payments it made for birth tissue, quote, stem cell treatments that were done for pain. Most of the major private insurers are following. So if you know someone who has had that type of treatment, please share this video so that they can go ahead and find out more. We will put the web address or the link for the blog that talks about this. And really, there's some things they need to do. They need to contact the clinic and see if they have an advanced beneficiary notice or what's called an ABN with that clinic. If they do not have one, then they probably, if they're on Medicare, they don't owe that money back. We're talking about $10,000 or so. If they do have one, then they owe that money back to the clinic, because the clinic's going to have to pay it back to Medicare. And it's going to be a real problem because these clinics are going to owe hundreds of thousands to millions of dollars back to Medicare. So long story short, please share this so we can get the word out. And then another question here from Adrian. Adrian, I'm so sorry sick about the PAOM today. Can you explain why we treat the PAOM? How do we know if it needs to be included in our injections? Two reasons. One would be that there's PAOM damage on the MRI. So if you've got a concern that it may have already healed after treating it, then a repeat MRI would show that. And that would just be a routine cervical MRI. And then the other reason would be because it's connected into a myodural bridge problem. But the biggest one is that at the end of the day, it's been damaged, and you can see that on a routine cervical MRI, on a good one, not a cheap one. So if you have any concerns, Adrian, about whether or not we need to continue to include that part, by all means, get another cervical MRI so that we can rule that in or rule that out. And you may want to talk to Dr. Schultz about that. Damien, how does regenexx advanced stem cell support formula stimulate stem cell production? Damien, we tested that in vitro, so we know what it does to mesenchymal stem cells in the lab. Now, whether or not it does that in patients is another story. We actually are in the middle of a randomized controlled trial for that supplement right now. But all I can tell you is that those supplement ingredients did the things we wanted with regard to mesenchymal stem cells in vitro, meaning in the lab. So that's the best I can tell you there. Regenexx, great. Here's the blog that talks about Medicare and amniotic placental clawback issue. And there'll be a new blog tomorrow, because remember, when I started this day, I thought this was just Florida, but I was contacted by a Medicare fraud and abuse contractor who sent me all the links to every single Medicare MAC around the country. So this is nationwide now in the entire country. If you had this, then you could be in deep doo-doo. So just wanted to get that word out there and make sure you share this video. Hey, Kim, thank you so much for your kind words. No such thing, CN, hoping you didn't hear that before. No such thing as umbilical cord stem cells, meaning that you can't get umbilical cord stem cells here in the United States. All of the products that are out there are dead cells. And that's based on a paper that we published in the American Journal of Sports Medicine. In addition, a paper that was published through Cornell. So none of those have any living stem cells. So if someone told you that, that's fraud. And then there's no way really to fix atlantoaxial instability unless we get to the ligaments that hold the head on. Now you can reach a few of those ligaments from the back, and if you've got a certain type of atlantoaxial instability and you inject the right stuff there, which is not going to be fake umbilical cord stem cells, then that could help. But that works in maybe 1 in 5 or 1 in 6 patients with atlantoaxial instability. The rest are going to need a direct injection, which comes from the front with that PICL procedure into those ligaments. But again, if someone told you that they were going to treat you with umbilical cord stem cells, that's fraud. There are no umbilical cord stem cells available here in the United States. That's just, a sales tool, and now it's a sales tool that's going to put some people in jail, which is really the original purpose for this video, other than to answer questions. Floyd, yeah, my goal is to protect you guys. And I'm hoping that none of you signed up for any of these things and now owe tons of money back to the clinic. I mean, there could be patients out there that owe $20,000, $30,000 because they got repeated multiple time treatments. So that's definitely something that we want to protect patients from. Damien, it would be ideal to take regenexx advanced stem cell support formula before and after BMAC, early before BMAC. We recommend it generally about 3 months before, and 3 months after is approximately when you should be taking that. Whoops, sorry, I jumped. Cian, it's in Mexico. Yeah, Cian, the problem there is going to be at the end of the day, there's not going to be a Mexican physician who would have the knowledge in how to inject these spots that need to be injected. I mean, this is stuff that needs to be done under X-ray guidance, and goes beyond even just interventional spine in knowing how to inject these specific ligaments. As far as injecting 0-1 in particular, as I always tell people on the show, be very, very careful with that, because doctors are no different than anyone. If I let's say I'm learning to play the guitar, and I've only played the guitar 10 times. As you might imagine, I'm going to be awful. Then I do it 100 times. A little better. I still don't sound great, but at least I'm not an idiot on the guitar. Now, if I play the guitar 1,000 times, I actually sound good. And doctors are no different. So when it comes to C01, in the United States, where we have actually much higher level trained physicians than in Mexico, there's probably only 100 US physicians that have injected C01 more than a dozen or 2 dozen times in their career. And of those 100 physicians, there's only 10 that have done it more than 50 times. And of those physicians, there's only 2 that have done it 1,000 times, and that's Schultz and myself. That's it. That's all we got. So be very, very careful, because if you do that one wrong, you end up injecting those cells directly into the vertebral artery, which means vertebral artery, brainstem, and cerebellum stroke. So not a good day for everyone if we get a stem cell related stroke because the injection was done by someone that's only ever done it 10 times. Again, think about the guitar. 10 times I'm an idiot playing the guitar. 100 times I'm not an idiot, but I don't sound good. 1,000 times I sound pretty good. No different here. I don't know what that means. Damien, what do you recommend 3 months before and after? Yeah, the goal of the stem cell support formula is to primarily control inflammation, or inflammaging, if you will, meaning that the average American has tons of systemic inflammation. The goal is to reduce that systemic inflammation both before the procedure to help the stem cell draw, and then after the procedure, because, for example, let's say we were trying to help your cartilage with a bone marrow concentrate procedure, which is what you're talking about. If you've got inflammation plus cartilage repair, what you get is hypertrophic cartilage. No inflammation plus cartilage repair, you get good cartilage. So that's the goal of what that's about. Debbie, should tethered cord and carry one be treated before PICL treatment for CCI? No, because you've just taken the ladder of invasiveness and turned it upside down. So a tethered cord release is massively more invasive than PICL. So to keep patients safe, again, it's always critical to understand you do the least invasive thing that has a likelihood of working. And then if that doesn't work, you go on to the next thing that has a likelihood of working that's more invasive, and then more invasive. So a tethered cord release is dramatically more invasive than PICL. You can do it that way. It's just not a good idea because you're exposing yourself to more risk than you need to. So if you need something like that after a PICL procedure, you can pursue it. I'm not a fan of tethered cord or detethering at all. Having said that, you would definitely not want to do it before a PICL, because that's putting a much more invasive procedure and exposing you to that risk that you may never have needed to be exposed to. Okay, guys, so any more questions out there that I can answer? Okay, I think I'm gonna start wrapping this one up just because I do have a hard stop at 2 o'clock. Or 2 o'clock my time. Anyway, thank you so much, everyone, for being here and watching today. Again, please share this video with anyone you know, because a very serious thing just happened with regard to Medicare and private health insurers no longer paying for any of these procedures and clawing back that money. So at the end of the day, that's a big deal where you may have a friend or family member that owes tens of thousands of dollars back and doesn't know it yet. Cian, can a neck collar help? Last question. If you've got CCI, a neck collar can make the symptoms better, but you wouldn't want to wear a neck collar all the time because that's going to lead to atrophy of the muscles that hold your head up. So using a neck collar rarely and intermittently when you need one is okay. And it can help CCI symptoms, but you wouldn't want to wear one all the time because of that atrophy. Okay, guys, thank you so much. Have a wonderful day. Please like and share this video. We got to get the word out. Lots and lots of people are in hot water here and probably don't know it. So have a great day.